Airway management specialists in Nigeria have identified inadequate medical equipment, shortages of skilled personnel, poor funding and limited professional training as major factors fueling airway-related emergencies and preventable death in hospitals. The concerns were raised at the 4th Annual Scientific Conference of the Society of Specialists in Airway Management, SSAM, in Ilorin the Kwara State capital, with the theme, Towards Improving Safety in Airway Management, a Multidisciplinary Approach. The experts stressed that effective airway management is critical to patient survival during emergencies, surgeries, and critical care, warning that failure to properly secure a patient's airway can lead to severe complications and avoidable fatalities.
So the challenges that face airway management in Nigeria are, I think the two challenges are equipment and training. So we need more equipment. We always need more equipment. Some of the equipment we use are actually even supposed to be disposable, as you use them once and then you discard. But you see us re-sterilizing, we rewash, re-sterilize, because we cannot just discard them. We don't have enough. So a lot of equipment, we need basic and sophisticated equipment, and then we need expertise training. So that's why you see this Society of Specialists in Airway Management, we organize workshops, airway workshops, because there are so many healthcare practitioners who are eager to have this training.
So airway simply means that there is a pipe in our throats that carries oxygen and brings out carbon dioxide. Oxygen is life. Oxygen is life. By the time a patient is unable to get enough oxygen, or within 4 minutes patient is having absence of oxygen, patient is likely to be dead. So that means that patient has a 4 minutes to live. That shows how important the airway is. So airway comprises of the trachea and the lungs. They are the store or banks of oxygen. So it's very important to know how to secure the airway so that patients will not be suffocated of oxygen. The commonest cause of airway collapse or upper airway collapse in an unconscious patient is our tongue. All human beings has a tongue. And once someone fell unconscious, the tongue fell back and blocked the airway. So before you could know, patient is dead. So a layman can be taught how to manage this first aid by inserting the necessary equipment, necessary apparatus that is not expensive.
Oxygen is very important. You must find a way to oxygenate the patient. Once the patient is well oxygenated, the patient will definitely survive. Everybody that cares about the airway, so that whenever a patient have a problem of the airway, they know the approach, because every patient must be cared for.
A lot of information has been shared within professionals, and this shows that there is a lot of collaboration that exists in the medical field, for us to impact positively on our people.
National President of the Society of Specialists in Airway Management, SSAM, and consultant pediatric anesthesiologist Dr. Mary Rose Osazuwa said airway management requires collaboration among multidisciplinary healthcare professionals to achieve better patient outcomes.
Airway management is key in acute settings, in emergencies, and even in cases that are not emergencies also. Airway management is very important, because if you lose the airway, you lose the patient. And the role of different healthcare practitioners in airway management is very important, cannot be emphasized. So airway management does not belong to any particular group of healthcare practitioners alone. It belongs to all of us.
Dr. Osazuwa disclosed that the society has over 300 airway specialists nationwide, but said the figure is grossly inadequate for Nigeria's growing healthcare needs. She lamented persistent shortages of essential airway equipment, limited training opportunities, and the reuse of single-use medical devices due to resource constraints.
Society of Specialists in Airway Management, we have over 300 members and we are growing. Now, for how many airway management specialists in the country, that is very difficult to answer, because the airway management, we have anesthetists, we have maxillofacial surgeons, we have otolaryngologists, we have the intensivists, we have the nurses. Even medical students can manage the airway. So we have all manners of people that manage the airway. Government should fund hospitals better. The government should look at protocols and guidelines that societies like ours come up with and ensure that persons are keeping to these guidelines, adopt these guidelines, and fund the hospital so that they have everything to work with that are stated in these guidelines. We cannot create guidelines and say, oh, use LMA, use fiber optic bronchoscope, things like that, when the government has not provided their hospitals with those equipment. So government should enforce guidelines. They should find a way to make sure that guidelines are adhered to, and then they should fund hospitals properly, equip them properly, and also encourage training. Some trainings should be mandatory. You know, if they make some trainings mandatory, and then they should give enabling environment for those trainings, not just to declare you must do them. They should also make it possible for those trainings to take place.
Usually we have little expertise in this country that manage the airway. So all other people need to join hands so that we can all be champions of airway. So people need to join hands together so that we can move the train together.
She, however, called on government at all levels to invest in modern medical equipment and make continuous professional training mandatory to strengthen patient safety and improve healthcare delivery.
Government should fund hospitals better. The government should look at protocols and guidelines that societies like ours come up with and ensure that persons are keeping to these guidelines, adopt these guidelines, and fund the hospital so that they have everything to work with that are stated in these guidelines. We cannot create guidelines and say, oh, use LMA, use fiber optic bronchoscope, things like that, when the government has not provided their hospitals with those equipment. So government should enforce guidelines. They should find a way to make sure that guidelines are adhered to, and then they should fund hospitals properly, equip them properly, and also encourage training.
The conference also attracted local and international experts who advocated stronger collaboration and sustained investment to enhance airway management and safeguard patients' lives. Rachel Arukoyo, reporting for Curious Television.
This is Curious Television, a professional online-based television committed to promoting truth, balanced and objective reportage without fear. Please like, share and subscribe to our YouTube and Facebook channels. Curious Television, fearless pursuit of truth.